Good afternoon, everyone. I think we'll get started. So, welcome to the Best Practice in Education rounds. These rounds are co-sponsored through the Center for Faculty Development and the Wilson Center. So, welcome to everyone joining us today. Please note that this session will be archived on the CFD website. And if you wish to see a live transcript of today's session, please turn on your closed captioning that you'll find at the bottom of your Zoom screen. I would like to begin with an acknowledgement of the land on which we work, study, and live. We recognize that many Indigenous nations have long-standing relationships with the territories upon which the Center for Faculty Development, the Wilson Center, are located that precede the establishment of the University of Toronto, Unity Health, and the University Health Network. We acknowledge that our presence on these traditional territory of many Indigenous nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, and the Haudenosaunee, and the Wendat people. Today, this land is home to many diverse First Nations, Inuit, and Métis people, and we're grateful to have the opportunity to live, work, and gather on these territories. We acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaty signed with the multiple Mississauga and Chippewa bands. Since these rounds are a virtual gathering, a singular land acknowledgement doesn't capture the richness of our distribution across many locations. There are few places on Earth that someone before us has not called home. I encourage you to consider your own position with regards to the land that you find yourself on. And if you are not sure how to locate Indigenous territories, treaties, and languages that shape both the past and the present of your current location, I invite you to take a moment now to look it up. One of the benefits of this virtual format is that we can engage in virtual resources. And so I ask that you take a moment to open up another browser window and type in native-land.ca. That is a crowdsourced interactive map, and it's built around the principles of land as pedagogy. The intention is to use these resources as an opportunity to critically engage in discussions about colonization, land rights, language, and Indigenous history. There are a few, the land acknowledgements are only a starting point for larger conversations. And of course, the more concrete acts of restitution and transformation are needed to address the underlying inequities and blatant discrimination in the distribution of resources between Canada's First Peoples and settlers. So before we begin, a few housekeeping details that I wanted just to point your attention to. If you have a question, please use the Q&A box. I'll be monitoring those throughout the session, and I'll give Teresa an opportunity to answer those at the end. And please ensure that you fill out the short evaluation that will be sent to your email at the end of this round. Your feedback is important to us, and it's really part of our ongoing improvement to make the Beeper sessions all the more valuable for you. So without any further ado, I'd like to take this opportunity to introduce Dr. Teresa Chan, who is our speaker for today. Dr. Teresa Chan is an associate professor at McMaster University. She's currently is the assistant dean of the program of faculty development in the Faculty of Health Sciences at McMaster. Dr. Chan is also the director of the Royal College's Clinical Educator Area of Focus Competency Diploma Program, and also the Competency Committee co-director of the Royal College's Emergency Medicine Residency Program. Additionally, Dr. Chan serves as the social media lead for McMaster's Department of Medicine. So Dr. Chan is very well known for her online education research efforts, and she's one of the founding members of CANI, and I'll need your help, Teresa, to tell me how you actually say the acronym. Canadian, okay, got it, website. And she's a primary investigator within the Metric Study Group. She's also the Chief Strategic Officer of the International Faculty Incubator Program for Academic Life in Emergency Medicine. And you pronounce that acronym as ALIUM, is that right? Yeah. So for ALIUM, she's also served on their editorial board and was a lead of the Medical Education in Cases series. Dr. Chan is interested in developing medical education innovations and of course evaluating them, which is near and dear to my heart. So for instance, she's also co-developed and is evaluating a series of games about emergency medicine flow, which is called Gridlocked. So without any further ado, let me welcome Dr. Teresa Chan.
Hi, everyone. Welcome to the rounds. So this is, today is Tuesday the 19th, and I welcome you to Best Practices in Education rounds. So thank you to the Wilson Center and Center for Faculty Development to concurrently kind of invite me here. All right. So we're going to talk a little bit about the future of health professions education, and then we're going to talk a little bit about what I like, what tips I have for the online environment. So you can tweet me at TCanMD, and definitely look forward to continuing the conversation because this is a new world that we're in, and we all need the faculty and peer support to get us through it all. Mhm. I have some disclosures in that I receive a teaching honoraria for the work that I've done previously for the Alien Faculty Incubator, which is a program that actually their applications are due right now, but the idea would be that it digitally connects people who are interested in education technologies and education scholarship together across nations. We've had people from Chile, from Pakistan, from the UK, Australia, to be able to connect in an online virtual community that engages in education scholarship and is meant for beyond beginners. I also have received a grant from the PSI Foundation to pursue the work that I do with regards to social media and how we use that. And of course, I also receive a stipend for the work that I do as the assistant dean for the program for faculty development. And so I will be speaking about all these. So there are conflicts of interest here that you should be aware of, but I'm actually quite proud of working with each of these groups. So I wear them as a badge of honor, really. Now, what is a futurist? When we're thinking about the future, there is actually an association of professional futurists that have actually defined a conceptual framework. And in education, we love to have our conceptual frameworks or theoretical frameworks. So you can scan that. There'll be some times that you can actually pop that up. All you have to do is take your second device, and in your iPhones, you can actually just hit the little camera button and then hold it up to your screen, and it should scan it and take you to the link automatically. So these are kind of like a technique for engagement and an extension of the work that you are currently trying to talk about. And so this would be one of the techniques that I'll use periodically. So you can take a look at some of those websites that I will talk about. So get your second device ready. Now, in terms of the framework that the futurists talk about, it's the idea that you will need to frame and define and scope the problem. You're gonna need to explore signals and indicators. You're gonna need to then begin on identifying baseline alternatives and futuring. You're going to need to develop a vision for what you prefer in the future, and then also think about designing and prototyping toward that vision. And finally, adapting and strategizing around alternatives when maybe your design doesn't work out. Today, we're going to focus on the second step of futuring, because I think that's where we're all are right now. We're exploring signals and indicators for what will lie ahead in the post-COVID era. And so I'm going to talk to you about 5 trends in health professions education that I think are going to push us towards our best practices in the future. I think number 1 would be the digital transformation of med ed and health professions education. This, in my opinion, can no longer be ignored. I think the COVID pandemic has certainly brought us to the point where we can actually say that most people now have some level of digital competency. And I think that this is going to make a big change. And so for me, this has been prompted by the pandemic. I mean, some people would beg to differ with me and I acknowledge that I might have moved into the digital world before other people did, but I have permanently changed my address to Zoom now and fully exist only on this plane of existence, I think. So that is definitely something that most of us, even if you were a digital native or someone who feels they were very comfortable with digital technologies before, I think the pandemic has pushed us even further into our digital selves. And so I do suggest that you look at the signals around, with virtual patient care being something that our patients in the clinical realm are demanding and actually enjoying. There's also digital learning, and I think that that's something that we've been trying to acknowledge is something that our trainees may or may not be super comfortable with or prefer, but is the reality of current lockdown state that we are in our current jurisdiction. And then there's digital teaming. And I do think that that's something that we haven't taken advantage of as much as we could in academia. Virtual patient care is something that we need to start thinking about how we engage with our patients, whether that's through Zoom or even just a telephone call. I think that that type of interaction is not something that traditionally is taught in the health professions. I know in my own medical school training, all throughout, uh, virtual patient care wasn't a big thread. And yet in our medical students class this past year, it's very clear that virtual patient care has become a very big growth zone in their future. And so they actually are doing standardized patient interviews on virtual patient care. I think that's a wonderful innovation that many schools have adopted. I do think that we're going to need to upskill ourselves with regards to how we engage in virtual patient care in the future and build that into the reality of our post-pandemic plans in terms of education. And the question is, are your faculty ready for this? And many of us are learning as we are also trying to teach others, and that's an acknowledgement that we need to do. And so in the summertime, we actually saw the signal, and you can scan here and look under the Inspired Teaching. You can go to our summer webinars that we actually did on June 25th and July 23rd. We've acknowledged that this is not a competency that many of us grew up doing. And so we actually worked with both the postgrad and the undergrad programs at McMaster's Faculty of Health Science to actually create some webinars. I've only done a screen capture for 2 of them, but there are another set that have to do with undergraduate students and how to assess them, but also how to teach them. And the other group that's been doing some cool innovations is the Department of Family Medicine, as they have many, many faculty that need it. They've actually created an e-module that actually helps with the training of faculty for virtual patient care. And digital learning is also something that we also have to think about in terms of training our faculty. And so the question is, with all the other devices that might be running at the same time, are you engaging your learners? And are we supporting our faculty? Because I think a lot of our junior faculty, again, grew up in classrooms and are not used to always teaching in the digital space. And so how might we best support this group as they are forming their identity as teachers? How do we actually make sure that they experience some learning? And I do think that this is where faculty development has its role, because I think that if a teacher is able to experience online learning themselves, they might be able to figure out what works for them and what doesn't, and then propel that into their own teaching. And so this is an example of some digital work that we've been doing at the McMaster Program for Faculty Development. We kind of put together a bit of a COVID-related online site that has all this content. And so we've converted over to free and open access faculty development. So a lot of the research I've worked on is free and open access medical education, but we're taking a step further and looking at free and open access faculty development for being able to upskill both our faculty, because paywalls are a huge way to prevent people from actually clicking on something, right? If you as soon as you hit a password protection, most of us give up and move on to another content. And so most of our stuff is available completely open access, and it can be used across, even between our institutions, which traditionally have had a bit of a sibling rivalry, let's say, but definitely go ahead and click use remix. Most of it is available as Creative Commons so that people can engage in this content. And so we also would like to extend the invitation for you to come to any of our live webinar events, just as some of our faculty are undoubtedly were able to click the link and register for the Beeper event today. We do also know that it would be great to have new voices and new faces in some of our synchronous content that we engage in. So if anything on our webinar listing appeals to you, you're more than welcome. And then I think that the other part is that we know that not everyone can make every session. You may have clinical obligations, you may have other teaching obligations, you may have research meetings that you have to go to. And so we've actually acknowledged that and begun a video archive so that we can have a Netflix-like a collection of little squares and content that would be useful to you in terms of your learning. And so we've actually got more than, this was a couple of weeks ago, but we've got over 70 digital offerings now. And we've also got other content as well that's digitally recorded direct to web. So just like Disney sometimes just goes directly to the vault, so do we. And so not all of our content comes through a live webinar first. Some of it actually goes directly to YouTube. So you'll have to figure out what those are. We also started a digital podcast called the Mac PFD Spark Podcast. It's available for subscription on Google Play and Apple's, and also on SoundCloud and Spotify. And so if you just search for Mac PFD, it's pretty unique. No one else is using that brand. You can definitely find our podcast, and hopefully you'll enjoy the content. I think we've got everything from, Doom and Zoom. We've got a whole discussion about that, all the way through to tips and tricks for surviving online teaching, to clinical teaching, to inspiring people to think creatively about their lives and their work. We've got a little bit of for everybody, so definitely check us out. And I think that in order to make all those things happen, we couldn't have made them happen without some level of digital teaming. And so that is something that we've been using as a platform called Slack. I actually I have no conflict of interest there because I just like their product. The other groups are using Microsoft Teams. That's also a great platform to be able to do that. And so an example of this is us, that podcast that I was just talking about, we needed to name it. And so we actually did an engagement strategy where members could actually vote on which title that they wanted. And as you can see, the Spark came up to the top. So that's why we named our podcast The Spark. And facilitates meetings and during synchronous sessions. So this is our back channel for when you're Zooming and, you want to actually throw a file to someone else and you don't have it enabled on someone's Zoom, and all the drama that comes with that. It also helps with back channeling if people are needing to converse it before or after the meetings. The Zoom chat, it's like if you had a Zoom chat that kept on going after your meeting, having a digital corridor like this in a community has allowed us to be more resilient in the face of the COVID pandemic. And so also becomes an avenue for us to do the water cooler conversations. And so we can actually see who else is online, and we might strike up a conversation that leads to a paper or a grant or other kind of engagements. And I think we also create a bit of a community because we can share information about things that are coming up. We can also then celebrate each other's successes. If someone discovers that someone's published a paper or won an award, we kind of have this little bit of a jam session where we celebrate each other. And I think that's really great. The second kind of big trend that I like to point out is that growth orientation is something that needs to be folded into every aspect of our organizations, especially in faculty development. I think about organizational growth as being a mindset. And I think that we preach to our learners that we want them to be lifelong learners. So are we doing that as faculty members? Are we doing that as our organizations? That's something we should wrestle with, because I think that until we do, they're not going to really listen to us. And so I might challenge all of you, and it may be that you're interested in digital learning. So maybe that's what your development plan is. But what's your next development plan? What are you going to read about? For me, I am kind of fascinated by the idea of talent and where it emerges from. So I've purchased a book called The Talent Code. Again, I just got recommended this when I was searching through Amazon. So I thought, hey, maybe I'll take a look at that. I'm sure there's other authors that'd be great, and I will hit those later. But I want to kind of continue my personal growth and think about how I'm able to integrate in my approach to both remediation, but also to think about how I focus on accentuating people's talents. And that's something that I'm working on. And so the other thing to think about is that, are you actually doing that within your organization? So are you, fostering each other? Are you pushing each other to think about new things, experiment with new skills, learn something new? And does your organization learn from its previous problems or mistakes, or how are we folding that in? Are you even just doing it within your class? So you had a disastrous Zoom one day. Well, can you debrief with your students and say, what can we do better next time, right? And I think that one of the frameworks that I've come across is Keegan and Leahy's deliberately developmental organizations. Is a framework that I think actually really puts together that as well. And I think to foster this, we were experimenting with building an online platform that's going to be called Quest, and it's going to be basically the short form is catchier than the long form, which is query-based ubiquitous educator and scholars training. But this is our take on problem-based learning 2.0. Being from McMaster, I have to mention problem-based learning and evidence-based medicine at least once, and so I've done my due diligence now. And I would like to kind of point out that, in the world of the digital, can we be asking questions of people without having necessarily to be in small groups, proposing problems that are, naturalistic to their own lives, and being able to put two and two together for busy faculty who may not be able to convene in small groups, but could they still be engaging in that personal journey, that quest to learn more stuff? And we think it is. And so stay tuned to our experiments, and we'll see how that goes. We do think that this is a new way that we can be folding in some learning into everyone's context, regardless of where they are, as long as they have some Wi-Fi and connectivity. And so we're going to be able to create a portal like this that can take you on a journey to discover a new world in faculty development. So whatever skill you want to work on, whatever aspect you want to explore. The third trend is that I think that social networks and connections will be important. So for instance, my social networks probably landed me in this talk, but I do think that having strong connectivity across centers. So, I'm really excited to know that some of your expert educators are all over the world, but they are so easy to access, whether it's online or by email. And it's been great to be able to interact with people like Maria, who's fantastic at what she does, and I love reading her work. But being able to connect with her, that's been such a thrill and privilege. But I think we can be advancing this in the future as well. For instance, the idea that we can foster connections between groups. So, Merit and FacDev here with CFT and Wilson Center, those are obvious connections, but I do think that we can be interfacing more in this way. And so COVID-19 has shown us that at least in the real life and in clinical life, we actually are increasingly using social connectivity to be able to spread information. And so within days of the pandemic being cold, I was on several WhatsApp groups with educators across the country trying to figure out how we're going to, upskill a bunch of emergency physicians to get ready for their PPE. How are we going to pivot our learning for undergraduate learners? How are we going to do this and that and the other? And I think that was really important for us to actually be able to do that. We actually got our physician group also on a WhatsApp group so they can actually exchange updates and things like that. And I do think that in medical and health professions education, maybe sometimes email might not be the best way to be able to create those networks and communities. And so it's really been interesting to see the experiments, right? And so traditionally there's a lot of hierarchy, but I think that in the world of social networks, we're going to be looking at non-hierarchical and open structures such as Twitter, such as a different perspectives that people are using, whether it's Instagram or TikTok or other platforms. I think that people are experimenting with that openness and being able to share. And I think that we need to be moving towards that as well. Not only are our teachers on those spaces, but also, not only are our students on the spaces, but we as teachers, I think, have the ability to learn from each other when we are engaging in these spaces. And I think that during the COVID pandemic, we've revealed a lot of social inequities because of the way that some of these big challenges in life always do. And social missions for our health professions education programs, our universities, our schools, this is definitely something that we need to consider. And so how do these socioeconomics and the environment affect the way that we engage with our community as academic leaders, as healthcare leaders, and how do we interface with that? And I think that social media is one of those disruptive forces in life that has made it easier for a person with a smart device and some borrowed Wi-Fi from, a nearby, institution, but whether it's a public library or just, those Wi-Fi at Starbucks, people are able to actually tap into a zeitgeist and the ability to exchange ideas. I think that that's a different level of engagement that we haven't had in the previous, and we need to think about how we incorporate that, and how do we close that town and gown divide between, the the ivory tower that we all situate ourselves in often within these institutions, and then how do we then serve the public and the people around us. And I think that the hospitals definitely are leveraging that community engagement through social media. Most of them have social media teams, are engaging with the news organizations and such through this. But I do think that as health professions educators, we also have to acknowledge that this is going on, and our learners need to be better prepared for that kind of engagement. And so, like I said, some of that engagement might just be having a WhatsApp between a bunch of educators across the country, or networking people internationally for emergency medicine. We do that. And there's also a meta network that's quite strong in Africa, apparently, where people share resources. We've also experimented with this around the Alien Faculty Incubator, and so we have, like the program descriptions are there, and then we've also written about this program in Academic Medicine as an innovation report, so you can read more about it. But this is a digital kick at the can of doing faculty development that's longitudinal, that's work integrated, where people are folding their academic work alongside their busy clinical lives, teaching lives, real lives, kids at school, at home lives. These are true kind of communities where people are fostering each other's academic growth despite all of the challenges of the pandemic. And it's been quite resilient and a chance for people to engage in having peer support longitudinally. So definitely check out the paper if you're interested in finding out more. And I think for me, it's been social media. We've seen, this is our lane, which is, when the NRA tried to tell doctors that they needed to stay on their lane around gun control in the US. That was a hashtag that arose. There's also Black Lives Matter. There was, more recently Med Bikini, where people were taking to Twitter to tweet bikini pictures of themselves because there was a paper that has since been retracted that actually suggested that maybe pictures of the sort from vacations might be unprofessional. And so there was a whole uproaring kind of about what that meant and what the implications and the gendered nature of some of those discussions were. I think that we've also seen a rise in women in medicine connecting this way. We've had women all over the world talk about Me Too. And I think that these are definitely ways that we can connect people. The I Look Like a Surgeon hashtag has generated lots of buzz both on Instagram and Twitter. So because of the opportunity to share what different people could look like and the representation that it's not all Grey's Anatomy all the time, I think that it's important for us to acknowledge that these are ways that the world is connecting, and therefore in medicine, we are starting to connect that way too. And so for MacPFD, we have, LinkedIn, Twitter, YouTube, SoundCloud, and we have digital events. And all of it is right now for open access during the pandemic. We will probably have to pivot at some point to having a better business model. But for now, it breaks my heart that, we aren't upskilling everybody and contributing to the fabric of improving healthcare and health education right now. So that's kind of our kick at doing that. And, free open access medical education or faculty development sometimes can feel just like another way to broadcast. Right now, I feel like I'm broadcasting to everyone. I'm not actually engaging with you. And so we've talked about in the past, that I have to talk about problem-based learning. So this is another innovation that we had through the academic life and emergency medicine teams. The ALIUM had this medic series. Now, the series itself does not run anymore, but we have like 48 cases or something like that and 5 ebooks that are about these kind of like educational cases inspired by the Harvard Business Review. We actually have these messy real life cases that we encourage people to engage in XMOOC or a connectivity MOOC where it was open access and they could just comment on these cases. And then we took those comments and intercalated them with expert commentaries and brought them together into resources. And so as you can see here, this is the workflow. We had a case and then we facilitated online discussion. In the back end, we were editing, expert commentaries and we'd go live with all of that. And then we actually bundled all of that together into publishable PDFs that are available for you to engage in small group learning and local discussions. And so if you go to www.alium.com/medic, you can actually see all of the cases from the very first one from 2013 all the way through to when we ended the series in 2019. And so what you'll notice is that just like any good show, we wanted to hit it. We were still pretty popular, so we wanted to close it off while we were still popular, so that like people didn't watch us degrade and wane. But we did end up remastering and publishing out the various case books, and so the collections are there, and they're available as I have noted, open access. And so you can go on ResearchGate or iTunes, and there we even have a page where you can just go to the Alien Library and actually look at all these resources and download them and read them at your own content. And so you can even read a bar paper as well in academic medicine if you'd like as well. We also wrote this as an innovation report. And if you're interested in other resources, Alium and the Faculty Incubator have linked up with the International Clinician Educator blog, and we've created a series of blog posts called Education Theory Made Practical that take educational theories, concepts, or models, and then kind of backtrack them so that people can learn about them. And those are all available online at the International Clinician Educator blog, so icenet.royalcollege.ca, or the remastered books are then placed in the Alien Library, also open access. So definitely check that out. If you're like, what does Kirkpatrick again? These are the resources that actually go into that, and they're very case-based and driven. And so again, we have so much open access content. We'd love for you to join, bask in it, roll around in it virtually, and just explore what it is that you want to find. And if you have any suggestions, or if you're interested in doing faculty development for us because you have a unique take or a specific angle workshop that you've given other places, definitely you can reach out to me on Twitter, and then we can look and see where we can fit you in. And the fourth trend is that we probably need to think about both entrepreneurial and entrepreneurial efforts to be able to foster innovation and sustainability. I think health tech is here to stay. We've got lots of health tech industries kind of coming into the healthcare sector. They're bringing with them artificial intelligence, data analytics, robots, nanotechnology, you name it. And I think that whether or not this is the truth of that robots and AI will replace us, maybe if they're this cute, maybe they can. But at the same time, we are seeing the rise of using cloud computing, digital technologies to integrate into health professions education. Research work, for instance, there's recently Amazon Web Services, they were saying that a resident has done a research project on diagnosing COVID-19 with CT scanners, and they're better than looking at X-rays, better than clinicians, better than the swabs, which is amazing. But like being able to spot and diagnose early COVID before someone has enough viral load, that's been tricky for us. And so it's been super interesting that radiology resident in UBC has been able to do this research project and use this large available technology to be able to integrate that in. And so that is the coming of the tide. And we do have to acknowledge that we're going to need to try to figure out how we can be part of the innovations so that we incorporate them well within our health professions education structures. And then also thinking about how we can actually inform them with our minds towards how we can use them for education, but then also integrate them within education. And I think that'll be a really big trend that we have to start thinking about as well. And I think the last trend that I'll leave you with is the idea that we need to be more agile in terms of how we act as institutions. I think it's hard when you have big institutions, multiple campuses, multiple stakeholders, and then it's hard to really change constantly. Sometimes we're waiting for accreditation before we actually really pull up our socks and actually make some change. And yet what I would suggest is that the only constant in life is change. And this is something that has been around as a saying for centuries. And we know that change is definitely something that has come to healthcare. So definitely at home, like there's always a crack here or a nick there and a chip on the paint. And we think about like how we can change our lives, right? Like how many of us have changed our offices a little bit around so that we can live better with our partners. I definitely have, changed locations, created temporary spaces. That's something that we're constantly doing. On the flip side, in healthcare, we are increasingly bringing in the discipline of quality improvement and improvement sciences. So whether implementation sciences or change management, human factors, and actually design healthcare design. These are ways that we're changing the health systems. And so it's obviously a big acknowledgement to leaders in this zone that are like Ryan Bridges, who's been working with the Andrew Petrozoniak and Christopher Hicks down at St. Mike's there to really make amazing change in the healthcare system, and used simulation, which we have usually used in the sim lab, and taking it to the main streets of actually creating different systems to improve how we're delivering healthcare. That's been a big game changer, and I do think that that's the kind of work that we need to start collaborating on. But the question is whether or not we're doing that with our education systems. And I think that a lot of us, sometimes because we're busy, because it's easier to just rinse and repeat, are we actually just being complacent in med ed or health professions education? I know I put med ed here because specifically the example I'm going to give of what we're doing locally at McMaster is tied to medical education. And the rules of accreditation and the cycles are a little bit different between the different health professions. But I think there's a temptation for us all to wait to the next accreditation cycle to figure out what we're not doing well, versus having a more of a continuous quality improvement and arc of Plan, Do, Study, Act that continues to innovate. And so one of the things that I think that we often have in health professions education is there's a bit of a gap. This is the CIHR knowledge to action framework. And I think that in medical and health professions education, we definitely do have a lot of knowledge creation. We do knowledge inquiry, synthesis, and sometimes we make products and tools. But then sometimes we don't really implement them as best we could. And we have to close that gap that exists between the little triangle and the outer circle. And I think that one of the things that we have to do is try to create systems that can actually do that. And so the McMaster Clinician Educator Diploma Program is a program that we have here at McMaster. I am the program director for this program, and the applications are open right now. But this is a vehicle by which we are trying to make institutional change. And so we have 3 active campuses and actually over 50 active trainees right now. Different people on leave and such like that. But generally speaking, we have about 42 to 50 at any given time active trainees. And they've been doing dozens of projects. So each trainee has 6 modules they have to do. And within each module, they're supposed to do some sort of project work that actually improves education. And so this has been a huge vehicle for change locally. And it's been quite exciting to see some of the projects that they've done. They've created simulation curricula. They've renovated entire academic half-day curricula. They've created outreach programs for simulation and community shops. They've engaged in creating simulation for psychiatry residents, for instance, or improving competence-based medical education locally. And I do think that those are the kind of systems that we can create. So I know that you have your Education Scholars program at U of T, but I do think that there is also the avenue of thinking about how we can merge systems improvement and leadership, and acknowledging that as a form of and an act of scholarly work as well. And so trying to figure out how that works in every context of course is unique to the promotions process and the systems that exist. But definitely the clinician educator diploma has been a huge get for us in order to really advance kind of like systems growth within health professions education, specifically medical education in that particular circumstance. And so here are the 5 kind of like trends again: digital transformation, or growth orientation, social connection, entrepreneurship and entrepreneurship, and how we link it to foster innovation in the future and fold it into health professions. And I think agility, about how we can actually differentiate with medical and health professions as institutions, how we're going to actually make ourselves a little bit more agile to be able to adapt to big changes, such as the pandemic. And so these are our 5 trends. And so what I'd like to do now is maybe there is the chat, and this is where I'd love to have some engagement here from everybody. What would be one of the trends that you thought most resonated with you? Just so that we can have, some signs of life from all of our participants. And I love that there's, I can tell 111 of you, that's great. But if each of you can just I'll throw them back up and you can take a look at them. Let me just go back here and maybe just, you can put the number, you can put a thought down. Go ahead and just take a moment and reflect on what it is that you think would be a trend that you've seen that you really want to work upon developing and your group in your location.
Maybe I'll reassure you, Teresa, that there's lots of signs of life in the Q&A as well.
Yeah,
So
yeah,
yeah,
there's like
some good
6
questions.
questions
Yeah,
or
yeah,
something.
yeah.
Yeah. Hello, Heather. Thank you for jotting that down. Yes, definitely. You've been a big advocate of the digital transformation. I see some votes for Catherine. That was a very, very enthusiastic 5 there. I love it. Yeah. Yeah. Ivor and Pascal have their votes there. People are pondering. There's so many good ones. Definitely. Thanks, Lauren. 1 and 4. Yes, I think that speaks to kind of like your interest as well. That's great. Thank you. Yeah, a lot of 1s here. Yep. 1 and 2. Yep. Thanks, Sajeev. Yeah, number 1 for sure. Yeah. Agility and change. Yep, definitely. I agree. 1 and 3 for sure. Catherine's like all of them. That's great. I love it. Yeah. Yeah, I think 3, I put it in there because it's something that's not so techy, but I think that the tech has allowed for voices to enter into the zeitgeist that might not have been there before. So I do think that there is a tech component to 3, and for us to um, hear voices and share in their troubles. I think that's been something that we could have turned a blind eye to, decades ago. But now with social media, it's just impossible to ignore the plight of people at this time. Mhm. All right. Well, thank you to everyone. You can keep replying there. I'm going to pivot now to asking. Maybe we can tackle some of the questions, and
Yeah,
then I'm going to go back and do some debriefing. So I'm going to maybe we'll do
yeah.
5 minutes of questions now, and then I'm going to do my last bit there.
Sounds good. So we have a hello from Heather McNeil in the Q&A and a couple of questions, but I'll start with our first question because it's a bit broader and bigger, and we'll probably give you a lot to chew on.
Yeah.
So how do you see faculty development in teaching and learning in the education and technology space occurring both during and after the pandemic? And thanks, and a great talk from Heather McNeil.
Yeah, I mean, Heather, I think there's 2 parts of faculty development that are important. So I think that faculty have to be primed to think about how they're learning in this space because they're learning alongside everyone else in the world. And so having an understanding of your own preferences, the way that you handle technology, the way that you've encountered it, I think that gives you great empathy right now as we're all learning in this space together to realize that when you're giving the webinar, how are you going to make sure that people can put their voices in the chat? How are you going to make avenues for people to be able to engage in your material and to be able to, for me, to remember that not everyone knows how to use the QR code, for instance, right? And so to actually have that QR code early in my lecture and then walk people through the process of how they might be able to engage in those little, barcodes and how to do that. And so I think that being on the other side of one of these things can often be a way for me to maintain my empathy for my students. I think that's a big thing that we can all be doing almost daily, right? Because we're usually partaking in some kind of webinar. You'll also notice what works and what doesn't work, right? So for instance, if I put myself here, I can't put my microphone right in front of my face. Everybody's like, why do you have it off to the side? I'm like, because I have to be on Zoom all day and people have to see my face. So these are simple things that you can maybe take note of when you have your peers and acknowledge that. I do think that after the pandemic, when we can actually be in the same room, I think lots of people will have lots of suggestions and advice. And I think that we might be like having everyone come together in computer labs and sharing, and how do you do this? And so I know that Harvard Macy had an ed tech course that they're now running online. But I do think that a lot of people had a lot of deep dive when they were sitting next to someone and said, "Oh, show me how you did that." And I think that those interactions we can't replace, and so we'll need to think about those and creating space for that in the future.
Yeah, that's kind of related to her second question, which was whether or not you would see education, fact dev as something that's more niche as an area or more mainstream post pandemic.
I mean, I have always thought that it's not a niche area, and that it was something that we always probably need to upskill people. I think now people have leaned into it. Heather, I think your CV is probably going to explode in the next little while, but I do think that this is something that increasingly will be expected. Digital competencies in teaching and actually in leadership will be huge.
So we have a question from Harini. How is the current med ed school curriculum changing to accommodate virtual assessments? So things like history taking via Zoom or physical exam remotely, et cetera.
Yeah, I can't comment on medical school at University of Toronto, but we actually have several webinars about medical school curriculum and health professions education curricula changing. So we have actually two recorded webinars, Harini, that you can actually check out on virtual patient care for the postgraduate learners. But there's also two that are about assessment and then also teaching and learning in the undergraduate world as well. And so I'm going to defer answering that question directly and ask you to just go and listen to great teachers from our local milieu, like Dr. Jason Perfetto, Dr. Matt Sibold, Dr. Sandra Montero. We've got some brilliant minds that actually have spoken in much more eloquent ways and more preparedly than myself. So check out our video library. So macpfd.ca, and then just hit the video library at the top and video archive at the top, and you will see lots of stuff that might be of interest to you.
So another question now from Lauren Costello. So do you think that there may be a shift in the future away from social media, or at least how we know it now? There's definitely an anti-social media movement, and documentaries like The Social Dilemma make me wonder how social media will change in health professions education in the future. Thoughts?
I agree. I mean, I think that open social media is going to change in the next decade. I think there's been certain forces in the US that have made that impossible to ignore. I would suggest that that's why I showed people that there are also closed social media networks that you can create that would be, I think they're going to be the way that people shift towards being able to do more connectivity. And so WhatsApp, Signal, Slack, MS Teams, these are the portals that people are going to be using to connect, especially within a community. And so I think that that's probably the tea leaves that I'm reading right now. And I do think that we'll see innovations. We'll have changes in algorithms. They're going to change things as well. And these things will come and go, and we're going to have to change the way we relate to them. But I don't think they'll ever stop existing, because I think people crave that connectivity.
All right.
And we'll do one more question.
Yeah, okay. There's a lot in here. So I'm just going down the list.
Exactly.
Yeah,
Ivor, right?
Ivor, yeah. So bedside care has continued to demand longer hours. Workplace computing has excluded much of the non-clinical use of the workspace data. Bedside clinicians have limited access to personal computing space. So how can healthcare systems provide more opportunities to explore and utilize these vast resources?
Yeah, I mean, I think that I think this is where there's some really cool innovations that are happening just in time, kind of apps that are plugins to electronic health records, for instance. That's how some of this is getting translated. I think, to be honest, a lot of people are accessing this kind of content in digital formats that are more compatible with this side of the screen rather than on computers. I think that making sure they have mobile responsivity to your websites, if you're creating them, like the blogs and podcasts that I work with, they're all targeting a mobile, like we're knowing that the website has to concurrently exist and be accessible in our phones and our fingertips, because that's how most people will probably see the world. And so I think we'll shift away from devices that are like larger, like your laptop, I think, at the workplace. And I think that more and more things will be point of care on the digital spectrum. All right, so I'm gonna maybe park it right now. I'm gonna have some thoughts because I'd like to do a little bit of debrief, just because people wanted a little bit more of a practical kind of like reveal as well. And so what I was gonna do is just do a debrief of the online teaching here. And I'm gonna give a shout out to my collaborators who kind of really have been formulating these ideas with me along a number of different webinars and resources that they've created. So that's Sarah Law, Yusuf Yilmaz, and Alana Bayer, who have been working on this approach to things. I think when you compare online and in-person teaching, there's a bunch of different ways that we engage in this differently. And I do think that, especially on a webinar format, I'm feeling the crunch of not having too much interactivity. It's really nice that the CFD people have actually, actually engaged with me, actually doing the Q&A together. Those are really, having a hype woman, like that's great, but it's not necessarily the standard. And so making sure that we are acknowledging that there are key differences between in-person and online teaching is really important. But I do think that having an approach and a model to be able to audit whether or not you've got all the components that are key, I think is important. And so the 4 that I can think of that we've put together into this algorithm is the idea of social and personal, activity, right? So what are the activities that you can do? What is the digital corridor that connects you in between? And then how are you actually delivering your education? And so that can be both synchronous and asynchronous. I think that if you think about those 4 kind of domains, and you think about the successful activities, whether as a leader or as a scholar and a teacher, you've done kind of your engagements. So for instance, in this one, checking in, dropping some hints, having a little bit of like the personal flavor of some of my jokes and things like that. That's kind of my way of putting the social and personal in. With 100 or so people, it's impossible to really have a good check-in. But if it's a small group learning experience, for sure, I would just, what's everyone watching for Netflix? Can you put it in the chat? That kind of thing. That might be a way to engage people. Activity zone in this case, I've kept it simple. We've already got both the Q&A and the chat. That's already 2 channels. We're happy to have those be the activity zone where you're actually engaging in something, putting something back in. The digital quarter, in this case, I'm asking you to engage with me on Twitter afterwards to be able to continue the conversation. So that's going to be our massive open digital quarter. I would say that maybe it's a digital online space actually, but definitely reach out and we can continue the conversation. And the educational delivery in this case was Zoom, although it's being recorded, so it'll be archived separately. And so that's also a way for it to be double dipped both between synchronous and asynchronous. And it's great that Lauren's here because Lauren's been in the faculty incubator, so he knows that sometimes you can also have an asynchronous discussion on something like Slack or Discord or MS Teams to be able to drive a conversation that doesn't need to be so synchronous, and that you don't have to invest so much time, but it's a couple of minutes here and there in between. So that's something to think about. I do think that trying to figure out how you can build some of that social and personal time is something that you can do to personalize it. I think that sometimes we forget the humanity of things when there's so many tech things and the cognitive load is so high for even just remembering how to screen share my slides properly sometimes. And I do think that having some personal stories, having some disclosure about your discomfort or comfort with certain things, I think that that's a really nice way to bring some of that in. I think when you think about activity zone, having collaborative spaces, just like when we actually did some of this stuff, the idea would be how do you actually create a space where you can all jam together? So whether that's an activity zone like this, or there's one of your own faculty members, Sarah Fuhi, has created something called the virtual recess room. So if you just search virtual recess room, she has a little website and she's created a little virtual resuscitation room on a Google Slides format where you can actually move things around and actually have a synchronous Zoom session with that form, and people can move around and resuscitate the little paper dolls that she's created within the zone. And so that's really cool, and that's a unique opportunity for activity to happen. And I think that this is an example of one of Alana's courses where she has all her TAs on a Microsoft Teams where people can be asking questions and getting answers from their from all of their teaching assistants. And so thinking about how you can integrate that corridor, whether it's something as big as Twitter or something as simple as a WhatsApp channel, I think that's another way and another format for engagement that can occur. And I think that, again, educational delivery right now, Zoom is like everywhere, but it's not all Zoom. So you can think about Microsoft Teams if it's a smaller group. You can think about um, WebEx. You can think about again, asynchronous modes of connecting. So some people have tweet chats, for instance. I know Harvard Macy Institute does tweet chats that are 24 hours long to make sure that all the time zones are acknowledged. I think that we can be thinking about different ways to do the educational delivery that are customized to the kind of media that we're hoping to engage upon. And so, and I think some of the common problems right now are obviously things to do with selecting the platform, thinking about going back to the basics of what are you trying to achieve? Are you trying to make sure that people can actually interface and actually engage, or are you trying to make sure that they just get information? Think about the platforms that you're comfortable with and that your audience might be comfortable with, and figure out ways to make it easier for them to engage. And think about how you can spot your blind spots so you're not always using the same tech because of your own biases. And I think that if you're looking for new ways to do this, we do have a series called the COVID-19 Teachers Collection that has a whole bunch of different resources that you can go ahead and take a look at. Some of them are blog posts, some of them are tip sheets, infographics. And if you're not comfortable with it, you know what? I think a big part of it is just being able to self-disclose, engage in that digital corridor, and just be humble and ask for suggestions for improvement. I think it's about including other kind of ways to stay human and share stories so that people will forgive you when you do your mistakes as well. And I think that we have to think about how we can actually stay human while virtual. And so Dr. Sean Park wrote this wonderful blog post that I recommend that you check out on our website. He did a really good job at kind of like giving some hints to people early on in the pandemic, and I think it still resonates with me today. So thank you very much for your time. And again, I think there's a couple more questions, so I'm happy to stay for the last 5 minutes and answer them.
Thank you so much, Teresa. I just want to maybe take this as an opportunity to also plug a few things on our own CFD website as well. We have a CFD resource page with a number of resources to really help you and support you in this new digital realm that we find ourselves in. And I think the conversation and the discourse I've noticed at the beginning of the pandemic to where we are now has slightly shifted, where it's less about just kind of taking what we did and finding a way to rapidly kind of make it work online, to actually really thinking in more innovative, creative ways around, how do we do this? What needs to kind of, move over, but what actually needs to radically be different, and what are the new things that we can take advantage of in this space? So it's been a really interesting shift just to see how educators, faculty, developers are kind of grappling with these issues now, a few months out. So I just wanted to share that there's a wealth of resources, not only kind of obviously in the McMaster space, but within our U of T community as well. So please check it out.
Definitely.
So why don't we'll maybe do one quick question just as a wrap up, and then I want to also do a little bit of a plug for our next session that's coming up for Beeper. So I'm just going to look at what has come to the top. I think you can kind of like a question and it pushes a higher up on the queue. So we're going to go with a question from Stella. This is an impressive array of work that you shared today, and I echo that with Stella's comments. Thank you very much, Teresa. So how do you reconcile the trends that you shared today with cautions about solutionism, so the tendency to jump to solutions and often see the technological solution prior to fully appreciating the root causes of the problems?
Oh, yeah.
And this is explored, she just put a bit of a plug here, this is explored in this month's special issue on the state of science issue in the medical education journal. So
Definitely.
what are your thoughts about this?
I'm hugely an advocate for us truly understanding the ins and outs of all the quote unquote solutions that we're doing, because I think every solution has its own baggage and its own problems that it brings with it, and there are always unintended consequences. I don't think that what I'm trying to say within the trends are that we need to actually look to these as solutions. I think we actually need to look to them as new problems and new zones in which we will have to find new norms. Just as Lauren's pointed out, right? With social media comes, a reaction that maybe it has taken over too much of our lives. And so to be at the forefront of that and acknowledge that we have to wrestle with those new tensions that emerge anytime we introduce something new, I think that is actually where the state of the science is. And I think technology is often seen as this huge panacea, a solution, band-aid, a universal band-aid, I guess. And as someone who works clinically, I know that there's no secret magic medicine I can give everyone to solve all their problems. Similarly, in education, we can't assume that technology, big T technology, is going to come along and solve problems for us. In fact, if anything, scholars like Laura Varpio have revealed to us that they bring their own problems in. When we move to an EHR, we change the way we communicate with people and with our patients and our learners. Like there are big changes that happen, right? And so thinking about how we understand each of these technological phenomena and how we actually explore the socio-materiality of these tech and how they actually impact the traditional structures, the ways that we used to do things and the way that they change. I think that's where there's some really cool innovation and really cool science to be done. And so we've been experimenting and thinking about how do we actually bring things like actor network theory into understanding how we created our first digital conference in May of 2020. We're still processing the information to be able to actually say, okay, how did the tech interface with people? How did the people then interface back with the tech? Because those are the questions that we have to wrestle with so that we can build better. And we can improve the systems that we have for education. So I think it's an exciting time, and it's not the end, it's actually just the beginning. The tech is just a new way to look at things.
I think that's a great note to end on. So I'd like to thank you on behalf of the CFD and the Wilson Center for presenting these really engaging rounds for us today. It's also an invitation for those who didn't get their questions answered. Let's keep the discussion going as per Teresa's invitation. Please feel free to tweet at her, to us at the CFD. Let's keep the conversation continuing for sure. I'd like to also do a plug for our next rounds, which will be held on February the 16th with Javed Sakera presenting on navigating personal and professional experiences of racism and bias in medicine. So I hope that you'll be able to join us on February the 16th for that presentation. Thank you again, Teresa, and thank you all for making the time out to have this really engaging conversation with us today.
Okay.
Bye now.
All right. Thank you everyone for coming. Bye.